Tyler Higbee of the Los Angeles Rams suffered a very devastating looking knee injury in their most recent matchup against the Detroit Lions. Now, initial speculation and expectation was that Higbee suffered a torn ACL, but he was going to have some further diagnostic tests to confirm. It looks like today the results of that MRI have come in, and unfortunately he did suffer an ACL tear. And it looks like as of right now, it's not sure whether or not he's going to start next season on time. With today's video, we're going to focus on the mechanics of the hit that Higbee suffered and why this is so risky for the ACL, as well as some other structures that are located in the knee. We'll talk about an on-the-field test that can predispose someone to think that someone has suffered an ACL tear, and we'll go over the grade of ACL injuries. Ladies and gentlemen, welcome to my channel. If you're not familiar with me, my name is Nick Gallo, and I'm a doctor of physical therapy. With my channel, I take a look at sports injuries, and I explain them so that they're a little bit easier to understand. I also talk about the relevant anatomy for that injury, and talk about what that person should expect when coming to physical therapy. If you enjoy this sort of content and you want to see more of it, please hit that thumbs up and subscribe to the channel, because I will be making more of these videos in the future regarding sports injuries, rehabilitation, and other physical therapy related content. Also, if you have any comments or questions, please leave those in the comment section below. We can see here on the injury video that as Higbee is going to catch the pass, he's going to step, and that right knee is going to get bent backwards very awkwardly. Here I have a model of the knee joint, and so the knee is formed by that femur, also known as the thigh bone, that's going to come down and form the top piece of the knee. Then the bottom here is formed by the shin, also known as the tibia bone, that's going to come up and form the bottom piece. As we flip the model laterally, we also have the fibula bone, which is another long bone located in the lower leg. It's important to know that there are four main ligaments that contribute to overall stability of the knee. The first one, and the most applicable ligament for this video, is that anterior cruciate ligament, also known as the ACL for short, located right in through here. As we flip the model medially or towards the inside here, we have the medial collateral ligament, also known as the MCL. We flip the model laterally or towards the outside, we have the lateral collateral ligament, also known as the LCL. And finally, as we move towards the back here, we have the posterior cruciate ligament, also known as the PCL. There are two other important structures that are located within the knee joint itself. They are the medial and lateral meniscus. You can think of these two pieces of fiber cartilage essentially as shock absorbers between the femur and tibia bones. Now let's go ahead and talk about the position that Higbee's knee went into on the hit. So anytime a knee is going to bend backwards forcibly, this is known as hyperextension. Anytime we're talking about extension of the knee, this is going to be straightening of the leg. The opposite of that is going to be flexion, where we're going to be bending the leg. We all have a norm value of extension that our knee can go into before it results in injury. Anything beyond this is known as hyperextension. So you can see as I bend this model beyond its normal value of extension, that is going to essentially stress all of the ligaments located in the model. And the one that is most often damaged in this position is in fact the ACL. Just because somebody goes into forced hyperextension, however, doesn't necessarily mean they're going to have a ligament tear. We saw this with Sam Laporta fairly recently, where his knee went into a lot of forced hyperextension and they diagnosed him with a sprained knee as well as a bone bruise. So it's important to say that, yeah, even though it looks horrific, it doesn't always mean that somebody is dealing with a ligament tear. In Higbee's case, they were saying initial tests made them think that he was dealing with an ACL tear. So let's go over some of those tests that can be done on a knee if somebody who's suspected to have an ACL tear. The first one that is commonly done is known as a Lockman's test. So what we're going to do here is we're going to stabilize the person's femur, and we're going to pull on that tibia forward. And if we're feeling any excess motion in anterior translation, also known as forward motion of that tibia bone compared to the non-injured side, then this makes us think that the person is dealing with a torn ACL. And this is a very important test because this is literally doing the action of the ACL. One of its major actions is to prevent that anterior translation of the tibia. So if you feel any laxity in this test, this makes us think that they're dealing with a torn ACL. There's another test known as an anterior drawer test, very similar, but it involves us pulling on that tibia bone coming forward as well. You do this compared to the other side. Once again, if there's laxity, then that makes us think that the person has torn their ACL. The gold standard, of course, to diagnose an ACL tear officially is that MRI. We know Higbee had it today, and that confirmed it, but there is a grading system, and there are grades 1, 2, and 3. In a grade 1 ACL injury, you're getting stretching of the ACL. In a grade 2, you're getting partial tearing. And finally, in a grade 3, this is where you're getting a full rupture. Anytime they report somebody having a torn ACL, this is going to be that grade 3 situation where there's a full rupture of the ACL ACL. Unfortunately, this is the worst case scenario because this usually means that without that ACL, the knee is going to have a lot of instability and that person is going to require surgery known as an ACL reconstruction. Initial phases of an ACL reconstruction mean that they're going to get a graft to essentially create a brand new ACL for that person. And after this, the person is going to be in one of these very big braces known as a drop lock brace. If any other structures are implicated in the injury, such as the meniscus, and they do something like a meniscus repair, this can delay recovery even more because they're going to have weight-bearing restrictions right off the bat. It usually depends on the surgeon though. Once the person starts to come to physical therapy, we can slowly start to work on range of motion and get it back to where it was prior to injury. Then we can start to work on strengthening. And finally, when it's applicable, we start to work on things like sport-specific movements and things like that. The recovery process can take anywhere from about 9 to 12 months. It really depends on the case. And this is why they're saying right now, he is at risk for not starting the season on time. If I happen to hear any updates regarding Higbee's case moving forward and essentially any news about his recovery process, I'll be sure to post that in the comment section. Also, if you happen to hear anything, please feel free to update us as well. So unfortunately for Tyler Higbee, it looks like he has an extensive recovery process ahead of him. It's going to require surgery along with a lot of rehab, but we'll be on the lookout for any news regarding his case so that we can essentially feature any updates. Thank you so much for tuning into my channel today. If you enjoy this sort of content, I'm going to go ahead and link another one of my playlists so that you can watch some of the videos that I've essentially talked about in the past. Thank you so much for tuning in, and I'll see you next time.